Good day, everyone. I am Dr. Manivannan, Consultant Clinical Oncologist from Beacon Hospital here today to share a little about cervical cancer. Cervical cancer is one of the most preventable and treatable forms of cancer as long as it is detected early and managed effectively. A high mortality rate from cervical cancer can be reduced through prevention, early diagnosis, effective screening, and treatment. Any of the following that I am going to share could be signs or symptoms of cervical cancer: abdominal pain, postcoital bleeding, pain during sexual intercourse, abnormal vaginal bleeding, discharge after intercourse, postmenopausal vaginal bleeding, bleeding or spotting between periods. What are the risk factors of cervical cancer? Almost all cervical cancers are caused by human papilloma virus, a common virus that can be passed from one person to another during sex. There are many types of HPV. Some HPV types can cause changes on a woman's cervix that can lead to cervical cancer over time, while other types can cause genital or skin warts. Other things that can increase the risk of cervical cancer are more than 3 sexual partners, early sexual intercourse before 17 years of age, high parity, giving birth to 7 or more children, low socioeconomic status, and smoking. Moving on to screening and diagnosis. According to WHO, all adult women should undergo periodic cervical cancer screening. Screening aims to detect precancerous lesions, that is, abnormalities in the cells of the cervix which, if left untreated, can develop into cervical cancer. When found, precancerous lesions must be treated. There are a number of recommended screening options available for cervical cancer, such as Pap smear test, the test of obtaining cervical cell samples for evaluation; colposcopy, which uses a lighted microscope to examine the external surface of the cervix during a pelvic examination. There are a number of recommended treatment options for cervical cancer, such as multimodality, there's a combination of surgery, chemotherapy, targeted therapy, and radiation therapy. Radiotherapy with external beam therapy administered from an outside source of radiation, and brachytherapy, which is the insertion of radioactive sources near the tumor for a fixed period of time. In Beacon Hospital, we offer Alcyon and True Beam radiotherapy system, where fast and precise X-ray dose delivered to cancer tumor with high accuracy over a minimum number of treatment sessions reduces unwanted radiation dose, thus minimizing side effects. Can cervical cancer be prevented? The answer is yes. Primary prevention for cervical cancer involves getting vaccinated against the human papilloma virus. Virtually all cases of cervical cancer can be attributed to persistent HPV infection. However, secondary prevention is by screening, which is vital as the HPV vaccine does not cover all the viral strains. Screening aims to detect precancerous changes which, if left untreated, may lead to cancer. Cervical cancer is the third most common cancer in Malaysia and is the easiest gynecological cancer to prevent with regular Pap smear tests, HPV vaccinations, and follow-ups. Always check with your doctor on the risk of cervical cancer, and often you should be checked. Led by a team of 9 resident oncologists, hematologists, multidisciplinary surgeons, as well as allied health staff to provide you the best, we strive to improve the quality of life for our patients from early detection, diagnosis, treatment to supportive care. Beacon cares for you. Your health is our priority.